Hi, my name is Rose Wataka. I'm from Uganda. I have 2 children. This one is Philip. I have also Thomas. I traveled from Uganda. Before I traveled, I looked for a good hospital to get my baby treated. He suffered from sickle cell anemia. He had a lot of pain. He used to get a lot of infection. I even lost my job because my baby was sick all the time and would not get out of hospital. It was very painful. Then when we heard about Aster Hospital, a friend connected us to Aster Hospital and we got to reach Aster, and they helped us a lot. Through Aster we were guided by Dr. Kesha when he told us about the bone marrow transplant, which would help Philip to stop suffering from sickle cell anemia. We were counseled by Dr. Kesha through all this, and we got to know how he was going to pass through it. Then when we were asked about the donor. The donor was our other son, Thomas. He was 100% match. We went through the whole procedure of bone marrow transplant, and Philip went through bone marrow transplant about a month in hospital. The services were really tremendous. They were good. We got all the care from the doctors, Dr. Kesha, plus all the nurses there. They were very supportive through the whole process. As we talk now, Philip is doing well. Philip is no longer getting no infection. Ever since we finished the bone marrow transplant, Philip is feeling well. Philip used to get a lot of pain. It has been months now. We have not had any pain. Philip used to have bad appetite. Philip now is asking for food all the time. The whole process was really tough, but we got support, a lot of support from the international office desk, from Shamil, from Bilal, from everyone at Aster who are surrounding us. My husband had to travel back to Uganda with Thomas. Thomas is 7 years old. He has to go to school, but I've never felt he's missing him because I have a lot of support at Aster. The staff is really doing great work here, and they have great services here. So I can recommend anyone who is out there looking for a very good hospital to get good treatment, to get good services, to come to Aster Hospital.
Good evening. Sickle cell anemia is a type of inherited blood disorder where the red blood cells, which carry oxygen all over the body, instead of being the normal shape, will become a sickle-like shape. So what happens is, for children, they will become very tired, very fatigued, exhausted. They will have recurrent pain crisis. Pain will be so severe that they may need to take pain medications, injection medications for their treatment. Sickle children will have recurrent pain crisis, recurrent chest crisis, recurrent episodes of infection requiring frequent hospitalization. Some sickle children can also develop stroke, that is infarct in the brain. It can be a silent infarct or it can be a manifestation where they can have seizures, loss of consciousness, weakness, not able to speak properly. Multiple hospitalizations will be needed for these children. The only curative option available is bone marrow transplant, also called hematopoietic stem cell transplant. Here we have a kid, a 2-year-old boy from Uganda who was having sickle cell anemia with recurrent pain crisis requiring blood transfusion very frequently. Luckily, he had a full matched sibling elder brother. We did the bone marrow transplant with brother as his donor. Now the child is sickle free, bone marrow transplant is a success, and he is free from infection, he is free from pain crisis, he does not require any further transfusion, he can lead a normal life. So, bone marrow transplant is curative for blood disorders, of which hemoglobinopathies like sickle cell anemia in this case, thalassemia are some of the disorders which can be cured by a transplant. And bone marrow transplant is a very complicated process where we have to keep the patient in separate room with air protection, HEPA filters, give chemotherapy, remove the patient's stem cells and infuse in the donor stem cells. Once the count improves, we discharge them from the transplant unit. Child's bone marrow transplant is successful, his counts have improved, he is feeding well, no complications, and he is planning to fly back to his native country. Thank you.